All right, next we'll talk about smoke inhalation. Um, Smoke inhalation injury happens in 3 stages. In early smoke inhalation, the patient may have carbon monoxide poisoning. They may have airway obstruction from either damage from the smoke or from fire. They may have pulmonary edema. About 24 to 48 hours later, they may have ARDS, acute respiratory distress syndrome, and then later complications can be pneumonia and pulmonary emboli. There are 3 types of injury in a fire. There are heat injuries or thermal injuries to the upper airway. Okay. So someone actually, the heat itself can cause burns in the upper airway, and that tends to cause extreme inflammation and airway obstruction. There are chemical injuries because when things burn, a lot of things that release gases that are toxic, and so we get chemical burns in the airway, and that can lead to ARDS. And there are systemic injury. So there are gases that are not toxic to the airway, but they interfere with or inhibit cellular respiration and causes ischemic damage to the tissues. So that would be carbon monoxide and hydrogen cyanide. So what happens with carbon monoxide is it actually binds to the hemoglobin in place of oxygen. It binds and doesn't want to let go. Oxygen binds to hemoglobin and then lets go when it gets to the tissues to oxygenate the tissues. Carbon monoxide binds and it stays there, so it blocks oxygen from binding. So what does that look like in the patient? They may have a headache, visual disturbances, irritability. They may have nausea, confusion, hallucinations, ataxia, so they're kind of stumbling. They can go into a coma. They may be pale or cyanotic, but they may also have bright cherry red lips. One thing you need to be aware of is that pulse ox will not detect this. So pulse oximetry measures how much of the hemoglobin is saturated with oxygen. Well, it can't tell the difference between hemoglobin bound to oxygen and hemoglobin bound to carbon monoxide. And so pulse oximetry readings may be normal when a lot of that is actually carbon monoxide. So we cannot count on pulse ox with carbon monoxide poisoning. Heat injury will cause inflammation or damage to the burned tissue, which will cause lots and lots of swelling. And that swelling will happen not immediately. So the person may be okay and talking, but their airway, if there's soot visible in the throat, their airway is at extreme risk and they probably need intubation. Chemical burns are usually painless at first, and then they have inflammation. They cause hemorrhage in the airway, so they may be coughing up blood, and then they may have symptoms of bronchiolitis, so they sound like those RSV kids, and atelectasis. Medical management is based on symptoms. They get oxygen therapy. For severe carbon monoxide poisoning, they may be placed in a hyperbaric oxygen chamber because that helps to force the carbon monoxide to release so that oxygen can bind. Other than that, supportive care. Anyone who's been exposed to smoke inhalation we need to be prepared for emergency intubation and ventilation. Nursing care, we're monitoring their respiratory status really closely. They can seem to be okay and then deteriorate really rapidly. We may be doing chest percussion and postural drainage if they have a lot of secretions. Managing fluid balance, any patient who's been involved in burn is going to have difficulty with fluid balance, and then support and reassurance.